Helicobacter pylori, a bacterium thriving in the acidic environment of the stomach, clings to the gastric mucosa and intercellular spaces. Humans are its only known reservoir, with transmission primarily through oral-oral and fecal-oral routes. This tiny organism is a formidable foe, capable of causing a spectrum of diseases. Helicobacter pylori has a high infection rate, high pathogenicity, high drug resistance, and low treatment success rate. Once settled in the stomach lining, it can lead to chronic gastritis and peptic ulcers, which should not be underestimated. Almost all infected individuals experience chronic active gastritis. About 15 to 20% develop peptic ulcers, such as gastric and duodenal ulcers. Moreover, Helicobacter pylori is a leading cause of gastric malignancies, with about 1% of those infected developing gastric cancer or malt lymphoma. Treatment can significantly reduce the incidence and mortality of gastric cancer, as well as recurrence after early gastric cancer surgery. Additionally, 5 to 10% of those infected suffer from related dyspepsia. Other less common gastric diseases linked to Helicobacter pylori include hyperplastic gastric polyps and hypertrophic gastropathy, along with systemic conditions like iron deficiency anemia, idiopathic thrombocytopenic purpura, and vitamin B12 deficiency. Symptoms of infection are often subtle, usually identified during routine checkups, but can include bloating, upper abdominal pain, nausea, burping, and bad breath. Diagnosis can be invasive, like endoscopy, which allows direct observation and sampling of gastric tissue for rapid urease tests, histology, and bacterial culture. Alternatively, non-invasive tests include the urea breath test, fecal antigen test, and serological antibody tests. The urea breath test, using carbon-13 or carbon-14, is the most common and convenient method, offering high accuracy without discomfort.